Most doctors won't say this out loud, but today, one is going to. Because what's happening to millions of elderly men in silence is something that could be prevented, if only someone had the courage to speak plainly. So stay with me, because what you're about to hear could genuinely change the quality of the rest of your life. Welcome back to BioWell Hub, the channel where we don't sugarcoat the truth about your health. I'm going to share something that urologists discuss behind closed doors, in clinical settings, in peer-reviewed journals, but almost never on a public platform. And it involves something most older adults consider too embarrassing to talk about: sexual self-stimulation, masturbation, in old age. Now, before you click away, I want you to understand something. This is not a conversation about morality, culture, or personal beliefs. This is a conversation about your prostate, your bladder, your hormones, and your neurological health. This is biology. And biology doesn't care about your discomfort. Let's start with the prostate gland, because that's where this conversation truly begins. The prostate is a small, walnut-sized gland that sits just below the bladder in men. Its primary job is to produce seminal fluid that nourishes and transports sperm. But here's what most people don't realize. The prostate needs to be regularly flushed out. When it isn't, the fluids inside it can stagnate. Think of it like a pipe that rarely gets water running through it. Over time, mineral deposits build up. Bacteria can accumulate. Inflammation begins to set in. This condition is known as prostatitis, and in older men, it can become chronic and extremely painful. Urologists see this pattern constantly. Older men who have become sexually inactive, either because of a lack of partner, shame, or simply the belief that sexuality ends at a certain age, begin to develop urinary problems, pelvic pain, and discomfort during urination. And in many of these cases, the root cause is simply a lack of regular ejaculation. Multiple studies have examined the relationship between ejaculation frequency and prostate health. One landmark study published in the journal European Urology followed thousands of men over nearly 2 decades and found that men who ejaculated more frequently had a significantly lower risk of developing prostate cancer. The research suggested that regular ejaculation may help clear the prostate of potentially carcinogenic substances and reduce cellular buildup that could eventually become dangerous. Now, this doesn't mean ejaculation is a guaranteed shield against prostate cancer, but the data strongly suggests that keeping the prostate active and flushed is protective. And for men who no longer have a sexual partner, masturbation serves that exact biological function. Beyond the prostate, there is another system being quietly affected: the pelvic floor. As men age, the muscles of the pelvic floor naturally weaken. These are the muscles responsible for bladder control, erection quality, and bowel function. Sexual arousal and orgasm are actually a form of exercise for these muscles. They contract, they engage, they maintain tone. When older men completely stop all sexual activity, these muscles begin to atrophy at an accelerated rate. The result is increased urinary incontinence, weaker erections if intimacy does occur later, and a general loss of pelvic stability. Urologists and pelvic floor therapists alike often encourage older patients to remain sexually active, in whatever form is appropriate for their situation, precisely to preserve this muscular function. Then there is the hormonal dimension, and this is where things get even more fascinating. Testosterone is the primary male sex hormone, and its levels naturally decline with age. However, the rate of decline is not fixed. It is influenced by lifestyle factors, and sexual activity is one of them. When a man remains sexually active, the body continues to receive hormonal signals that support testosterone production. When sexual activity stops entirely, that hormonal feedback loop weakens. Lower testosterone in elderly men is linked to fatigue, depression, loss of muscle mass, cognitive decline, and an increased risk of cardiovascular disease. Simply put, staying sexually active in old age is one of the most natural ways to keep your hormonal system at least partially engaged. There is also a neurological benefit that is rarely discussed. Orgasm triggers the release of a cascade of neurochemicals: dopamine, oxytocin, serotonin, and endorphins. For elderly individuals who may already be battling isolation, depression, chronic pain, or anxiety, this neurochemical release offers measurable relief. Research in gerontology has shown that older adults who maintain some form of sexual activity report higher levels of life satisfaction, better sleep quality, and lower rates of depression. The brain, much like the body, benefits from stimulation, and sexual pleasure is one of the most powerful forms of positive neurological stimulation available to the human body at any age. Now let's address the elephant in the room. Many elderly people believe that sexual desire in old age is abnormal, that it's something to suppress or be ashamed of. But that belief is not only wrong, it's harmful. Urologists, geriatricians, and sexual health specialists are unified on this point. Sexual health is a component of overall health. The World Health Organization defines sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. There is no age at which that definition stops applying. If you are an older man reading or watching this, and you have stopped all sexual activity, including self-stimulation, because you thought it was no longer appropriate, I want you to hear this clearly. Your body still needs that maintenance. Your prostate still benefits from regular flushing. Your pelvic floor still needs engagement. Your hormonal system still responds to sexual signals. And your brain still deserves the neurochemical rewards that come with pleasure. Talk to your urologist. Ask the questions you've been too embarrassed to ask. Because silence in this case is not just uncomfortable, it is medically costly. Thank you for trusting BioWell Hub with your health. If this video gave you information you didn't have before, please share it with someone who needs to hear it. Hit that subscribe button, because on this channel, we will always give you the truth your health deserves. See you in the next one.